Our patient is an 80-year-old male with the right CVA, presents to PT 4 days post-stroke. He is sitting in a wheelchair, his head and eyes are rotated towards the right, and his left arm is hanging over the side of the wheelchair. The patient is displaying a phenomenon called unilateral neglect, which is a common residual deficit of both right and left-sided CVAs. Neglect usually occurs more dramatically in the left hemispace in association with lesion of the right hemisphere. Researchers have used mirror therapy to address the functional limitation of unilateral neglect. In a recent randomized controlled trial, the researchers provided 1 to 2 hours of mirror therapy a day for 5 days a week for 4 weeks. The patient should be placed in a stable seated position with the mirror in front of them, blocking view of their paretic hand. Sensory tapping can be applied to increase awareness of the paretic limb, like shown. The patient will then be instructed to perform flexion and extension of the fingers and the wrist of their non-paretic hand, and then encouraged to perform the movements with the paretic hand as well. This exercise can be further progressed to include more complex, functional upper extremity activities, such as combing your hair, drinking from a glass, or eating. The therapeutic basis behind mirror therapy is that it provides a visual illusion of the affected hand moving, which may help recruit the premotor cortex through connections with visual association areas in the brain. Mirror neurons are also activated upon observation, which will reinforce the learning. It should be noted that although mirror therapy is effective to address the visuospatial deficits of unilateral neglect, it should only be used as an adjunct and not a replacement for other interventions such as gait training or transfer training. Any interventions should be personalized to comprehensively address the patient's unique impairments.